Hi, I'm Don Mackey from LCAT, and I'm here with Town of East Long Meadow Health Director Amy Petrosky with another health update around the current vaccination program in Massachusetts and in East Long Meadow in particular. Some of you may know that the over 75 cohort has been receiving their first and now second doses since January 5th. The health department staff, the COA staff, and Paul Morissette and the East Long Meadow Fire Department have done an amazing job providing those vaccinations to that cohort. And Amy will talk about this shortly. That is coming to an end now with the changes in the state rollout of the vaccination program. So let's get right to it. Amy, thanks for coming over.
Yeah, thanks for having me. Someday I'll be able to be back in that office again.
Yeah, I know, right?
We'll be in the same studio.
What's the status as of today of what the health department and the fire department, that town-run health department program, what's the status of that as of today?
Yeah, so the health department made a robocall to community yesterday afternoon, and announced that we will no longer be getting vaccine from the government to continue round one doses. So just to be clear, really clear up front, anybody who's already received a vaccine with us is still able to get their second dose with us. And that is something that the governor has said is still going to continue. But as of yesterday, local health departments and are not receiving any further doses for first round vaccines.
So how many local health departments, say, to your knowledge, in say Western Mass or the Pioneer Valley, have been doing what you were doing at the town level?
Oh, I don't know the number. I do know back in December when the governor and DPH asked local health departments to kind of stand up and help vaccinate our first responders. East Long Meadow was one of the only local communities who was able to do it with such short notice. We were able to complete all the paperwork and get our approval in a week. So there were 7 communities that asked to join us in vaccinating their first responders because their communities didn't have something that allowed them to be vaccinated there. So we were able and willing to help our other communities and vaccinate their first responders. Our clinic was such a success, DPH allowed us to move into the rest of phase 1 rather quickly. And that's when we started vaccinating COVID-facing medical professionals, non-COVID-facing medical professionals. School nurses were included in that phase, dentists, speech pathologists, other critical infrastructure. And we were happy to be able to do that. And we have officially finished the second round of phase 1. Because we had that first clinic for phase 1, we were able to seamlessly move into starting the phase 2. So when they opened the 75 plus, even before the 75 plus were open, the town of East Long Meadow health department set up that waiting list that many of you are familiar with that allowed you to call or email and get yourself on a list. That way, if we got to the end of the day and there were any vaccines left over, instead of wasting them, we were able to call people to come in with very short notice so we could get them in people's arms versus, putting them in the trash. And then also that list allowed us to really quickly move into the 75 plus community the same day that the governor allowed us to do that. So that's how we were able to move into the phase 2. I forget what the initial question was.
No, that's fine. But so just that I was asking sort of what the status is.
The other communities. Yeah. So I know since phase 2 opened, Long Meadow and Wilbraham have been able to stand up a clinic. So they were also affected by this decision.
And I don't want to take too much time because I sort of want to get to what people need to do because I think that's the most helpful thing. But the reason for the change from the state's standpoint, my understanding is that it was to each of those communities, you, Longmeadow, Wilbraham, being relatively small sites, was to sort of pool that vaccine to sites where they just get more volume of patients on a daily basis and deliver more vaccine. Is that
that's what the governor has said in his press conferences, but I don't personally understand that logic, right? Whether you're taking 100 people from East Longmeadow and bringing them to a mass vac site in Springfield, or you're letting those 100 people from East Longmeadow stay in East Longmeadow, and you take 100 people from a community that doesn't have a health department that's able to do this. Because
correct.
We live in an area where there are many towns that don't have as a robust health department as East Longmeadow does. So if we are able to support our own residents, it opens up those spots for people who don't have health departments who can stand up their own clinics. So the logic there is somewhat flawed, at least for Western Mass. Maybe in, where there's in Eastern Mass where the population is much denser and things like, and they do tend to have more robust health departments, that made sense. But for out here, it's just different.
Right. Okay. Well, so I just wanted to put out there ostensibly what the reason was for the change, because it's clearly had a direct impact on this community and the way that, the community had started to undertake the vaccination of its residents. So,
yeah, and actually, I wrote a testimony to the Public Health Oversight Committee last week, who was having conversations with the Charlie Baker and Secretary Sutters on the vaccine rollout process. And one of the key parts of my letter is East Longmeadow's demographic. We have, about 40% over 60. That population has been adversely affected by this virus. And by allowing them to receive the vaccine in their community where they feel safe, it's a improvement in the health equity, right? So now we also were a community that was red for over a month. I don't remember what it was, but we had a long run sitting in the red. So if you look at the demographics of our specific community and the ability that the chief and I had at providing these vaccines to our residents, it was a decision that really just didn't make sense.
So that leaves people in the 65 and older group. So let's just to clarify, let me go back just a minute. The over 75 cohort, everyone who received a first dose, you are still dispensing the second dose for those individuals.
Correct.
So that the program, the clinics, you're running the clinics, but the clinics are essentially closed to new vaccinations.
Correct.
So the over 65 cohort, when they opened up that cohort last week, myself included, who had thought, well, I'm going to get myself on the waiting list down there at the senior center and sort of be in the next group. Suddenly that became unavailable.
Yeah.
What do we do now?
So in the robocall and email that I sent out yesterday, I provided 3 options for people who are still looking to get vaccinated. One is the Vax Finder, and that's just vaxfinder.mass.gov. And that's that website that everyone has had such great things to say about. And
Snark alert.
It takes a lot of patience. There are some, I consider myself fairly computer literate, and I have been trying to book my mother, who lives out in the eastern part of the state, an appointment for weeks now. And you start on a clinic that says they have 785 appointments. You get through to the end, and then you go to click your appointment, and it says 0. And that's all in the process of, a 2-minute registration process. And then you have to start that all over again. So it has caused a lot of frustration for our residents. And even though we are no longer giving the vaccine, we're still getting those calls. I just did a report for town council. In the month of February, we received my department, health department, received over 500 calls. And the vast majority of those were looking for a vaccine support, whether it was through us or someone else. So you might have to wait a while. They did start a new system to make it more fair, where it's like a queue when you try to get sporting tickets or concert tickets. You get in, you get kind of a place. They tell you approximately how long that's going to be, and it's long. But once you get in, they tell you where the appointments are, and that spot is guaranteed for you. So it does eliminate what I was experiencing, where you get in, and then by the time you're done, your vaccine is done.
Right. And that's fairly recent. That's within the past
Week.
few days, right? That they've made that.
It started last Thursday.
Last Thursday, yeah. All right, so that was one option. The other thing I will say about that is be prepared to travel, right? So if the only vaccine that you can find is in Berkshire County or one of the MassVac sites out in Eastern Mass, that might be the best opportunity for you to get a vaccine. Those mass vaccination sites are primarily located out in the eastern part of the state. So if you have the ability. Fenway.
Yeah, Gillette, Fenway, and there's another one, I think, happening in Worcester. If you have the ability to travel, opening kind of your search parameter and thinking about, like, I'm going to make a day of this might allow you to get a vaccine sooner than continuously trying to find one local.
And maybe using up the same amount of time.
Yeah, right. You can sit on the computer for 2 hours, or you can travel and
get on the turnpike. Second option.
So the second option, and I've heard really great things from some of our residents about the clinic that Big Y is holding over at the old Staples space. The links are also on the newsflash page, homepage for the town, the COVID page, COVID-19 page that the town has, as well as the health department Facebook and website page. So if you prefer a click versus writing it down and then trying to put it in, you can find those links at any of those places.
Great.
And then if you're someone who needs a little bit more support, if you do not have internet or a computer, you can call 211 from any phone, and they will assist you. So two things about that is, one, they will ask, do you have internet or do you have a computer? And if you say yes to any of those, they will not book your appointment for you. So you have to be really clear that you don't have the ability to make the appointment. And the second thing is, they don't always have appointments available. So I do know that they have a wait list. If you call looking for a vaccine and they don't have one for you, they add you to a wait list, and then as they have vaccines available, they call down. It doesn't increase your chances. It doesn't move you up in the queue. It's just a way for people who have trouble using the computer to have equal access to these vaccines.
I'm going to guess that a large number of people who might be watching this have already been through this process, and maybe we're hoping to jump on this video and get some information that would sort of change the dynamic a little bit. At this point, it's not happening today or probably tomorrow. Just to back up a little bit, the issue. So there's the website issues, and that came up in the hearing last Thursday, and the governor had to apologize for the fact that, I don't know, for some reason the people who put the software together and administer the website were apparently, so they said, unaware that the 65 plus cohort was going to open up and suddenly add like a couple million people to the pool of people looking for a vaccine. So there's that sort of side of it. But then the other issue that is sort of underneath the whole thing is supply. So just, if you want to just talk a little bit about, why there's a shortage, right? And sort of where that shortage originates, how it works its way to Massachusetts, and maybe we can add in, if you want, the Johnson & Johnson, and sort of what the time frame looks like moving forward as opposed to the past, 2 months? Yeah.
So as far as I know, and what is being communicated to us, and I'm not sure that that's much more than you guys are, most people are getting just in their news sources, but From what we're being told is it's a manufacturing delay, right? They just can't produce these vaccines at the speed of which people are looking to get vaccinated. So it's really just about trying to catch up with that. I think the new Johnson & Johnson vaccine is going to make a big dent in that. One, because it's a one-time dose versus 2 times. So the resources that go into vaccinating someone twice versus once is just dramatically different, even just the registering phase.
Right.
And the second piece of that, which I just learned today, is one of Johnson & Johnson's biggest competitors. Let me get what that is.
Merck.
Merck has agreed to produce the Johnson & Johnson vaccine. The deal was brokered by the White House. So that is going to dramatically amplify the speed in which the Johnson & Johnson vaccine is going to be manufactured. And it's going to allow us, communities, to vaccinate more people at a faster rate. So I'm hopeful that we will start to see some relief in the delays that people are experiencing. I don't know if that will make any difference in the governor's decision to allow locals to vaccinate again, if there's a better supply coming into the state. I'm not sure what effect it will have, but we can always hope that we'll have the opportunity to start vaccinating people again.
So I guess that provokes me to ask is, do you, from where you sit, hold out some possibility then that your ability as a public health department in the town of East Long Meadow that was administering vaccines is now not able to administer vaccines might actually move with more supply back into that position? Or is that just, I mean, I'm not trying to put you on the spot, but I hadn't really thought about that. It sort of seemed like, well, the governor closed that door and that door's been closed. But yeah, you make an interesting point that it's conceivable that you can get back into it if there's more vaccine to give.
Yeah, well, the governor, we've seen this through the entire pandemic, which is there are a lot of decisions made that the people who are affected don't find out until it's announced to everybody else. Like we saw that with the regulations that the health department had to enforce. We found out when everyone else found out, and that made it a little challenging because as soon as we found out, our phones were ringing. What does this mean for us? And we hadn't had any leeway or jumpstart on how to digest what they were asking us to do. The same thing happened in the first round of vaccines. On a Friday, we were told in one of our twice a week DPH calls, local public health is not going to be vaccinating at all. And the following Tuesday, which was the week of Christmas, they said, we need you to vaccinate. Please let us know immediately who is able and willing to do so. So in those 4 days, what they were asking us to do changed drastically.
Yeah, like 180 degrees.
Yeah. And that's when Chief and I sat down. It was the week of Christmas. We were both off and we sat down and said, well, our community needs this. We have, like I said earlier, a demographic that just would benefit from us being able to provide this in our own community. And so those types of things happen. And then we're just kind of left dealing with the repercussions. Same with the 60s. You mentioned the 65 opening and the website not having a heads up on that. We didn't either. We had started the wait list on the 65 plus the week before, just so people felt like they had someone, they had someone who was listening and they had a place in line. We didn't have a vaccine yet, but we could offer people some peace of mind knowing that when we did, they were in line for it. So that's why we started that 65 plus wait list.
Gotcha.
It worked well with the 75. It worked well. So things happening without us knowing is not new. So if they did come back and change it and say, okay, who now wants to do this again? I wouldn't be surprised. And even though we're not doing the actual vaccinations anymore, we're still willing to help, and not just willing, but happy to help our residents try to figure out what their next best step is.
Okay, so what's the best way for people to do that?
Yeah, so they can just call the number they usually do, 413-525-5400, extension 1103. We can't make the appointments for you anymore, but we can try to help you navigate the process. I also know if you're a resident and you are getting vaccinated at the Springfield site, the Council on Aging has a trolley and they will take you to that vaccine. You would call 413-525-5400, extension 1410. So 1410 to book that appointment. Can I make one public health statement?
Please, anything you
Good.
want.
All right. So I'm going to use this platform. So just if you have already received the vaccine, the CDC does recommend still following all the same mitigation factors that you were following before the vaccine. So continuing to wear your mask, keep your social pod small, maintain 6 feet of social distancing until we know exactly how effective these vaccines are in either preventing infection or just eliminating transmission. It's good to try to still follow all of the same things that we were previously following. One of the reasons that's really important right now, even though I know we are all so tired of following these practices, is by eliminating an increase in the spread of the virus, we are also reducing the likelihood that we see different variants of the virus.
Right.
And the variants are going to be really what can continue to cause us significant problems, even if we are vaccinated, because we don't know what that will do. So, and an epidemiologist could speak so much more eloquently on the different variants and what those mean than I can. But I do know that by eliminating the spread, we reduce that chance. So I know it's hard, but even if you are vaccinated, mask up and keep that social group small.
That's great. Well, and I want to say too that, I think the town is certainly very appreciative to you, Town Manager Mary McNally, Fire Chief Paul Morissette, the Fire Department, Mary Beth Dowd, and the COA for everything you guys have done up until now and continue to do. And we're very fortunate to have such committed and compassionate experts working on behalf of all of us. So I just wanted to pass that along. It's still out there. There are still cases. There's still transmissions occurring, and people are still impacted by it. And I think prudence is really the key. I know everybody's sick and tired of it, and the nice weather is coming, and people want normalcy again. But man, we made it this far. Let's not jump the gun and see it all go downhill, Because I'm running the Zoom, I guess I get to give my opinion.
Yeah. The final word.
Amy, thanks so much.
Thank you.
All right, I'm Don Mackey from LCAT. Check back for another health update, but we'll see you next time.